Good day, sir. I am Ricah of BSN1-D, and today I will demonstrate how to give a bed bath to a client. So the purpose in giving bed bath is to remove transient microorganisms, body secretions, excretions, and dead skin cells. Next is to promote client's comfort and relaxation. Third is to promote circulation to the stimulate circulation to the skin, and last is to prevent and eliminate unpleasant body odor. So for the assessment, the first thing that we need to do is to identify the client. We can do that by asking their name, checking their tags, or asking their relative. So the next is to explain to the client the procedure that we're going to do so that they are aware of everything. Then, for planning, we must always remember universal precaution, washing our hands. And then next is to remove all unnecessary materials on the bed and clear the working area. Then after that, we need to arrange all the materials that we're going to use. And we need to put a rubber sheet, plastic, or newspaper on the table where the basin is to be placed. So after preparing it, the next thing to do is to provide privacy, and we can do that by closing the door and drawing the curtains. We can also put a sign or lock the door, and then after that we need to close the window and turn off the air conditioning units. And then after that, we need to raise the bed into a comfortable working height. Next is to invite a relative, a family member, or significant other to help us with the procedures. And next is to offer a bed pad or urinal to the client if desired. So for the implementation, the first thing that we need to do is to loosen top sheet. After that, we need to assist the patient to the side of the bed. And then, we need to remove the gown and then ask the patient to hold this. Next is to lay a bath blanket to the patient. Ask the patient to hold. And then remove the top sheet. So, after that, we need to prepare a warm water. I already prepared one. And then, next is to spread a bath towel behind the patient. Spread another one on their chest, on the top of their chest. Then we can now start with the bed bath. We need to soak the towel. Make sure that the excess water is removed. Then form a knit. You can form a knit by doing this. Fold the towel on your hand. Fold it again and then tuck it. We start off by the patient's eyes, from the inner to outer canthus. You should do it gently. Then we need to rinse it. Do it on the opposite side. Wash the towel. Then we can now do starting from the forehead, cheeks, and neck. And after that, we need to dry it using this towel. So now we're done on the face, and then the next thing is to lay a bath towel, spread a bath towel under the patient's arm. Then wash the towel rather. Make sure to remove excess water. You need to place the basin on the bed and soak the patient's hand. You need to place it carefully. Then while soaking the hands, you can start with the arms, starting from the wrist to the shoulder. After that, we can now clean the hands. Make sure to clean between the fingers. Dry the hands with this towel. Then now to just do the same procedure with the other hand, other arm. Then we can now proceed to the chest. We need to put the bat blanket onto the pubic of the patient, and then spread a bat towel over her chest rather. Then after that, we need to clean now the chest of the patient with long firm strokes. We need to take note of the skin under the breast. Then after that, dry the chest of the patient. So next is the legs. Need to remove the bat blanket to the pubic region. Then place a bat towel under it. If needed and necessary, we can change the water on the basin. Then we're now going to clean the patient's lower extremities, starting from the ankle to the knee, and then knee to the hips. Then we need to wash the cloth, the towel. Then clean the foot. Between the fingers. After that, we need to dry it. Then next is we need to ask the patient if they can do prone position, or we can put them into their side. Wash their back. Make sure that the bath blanket is covering the patient, only exposing the back. Again, using long firm strokes starting from the nape to the down there. Before starting, we need to place a bath towel lengthwise. Again. After that, we need to dry it. Then we can ask the patient if they want to have powder on their back or lotion. The next is going to their buttocks. Dry it. Then ask the patient to do a supine position. If the patient is able, we can ask them to clean their perineal area. Then after that, we can now change to a new gown. So if the patient has an IV line, we need to insert or start from where the IV line is. Then after that, we need to make sure that the bed is is neat, nicely tailored, and then after that, we need to wash our hands. Then for the evaluation, we need to consider if the patient is comfortable while doing the procedure. Um, then next is to assess the skin status, and for documentation, we need to record the skin